And first of all, it's my dear colleague and friend, Didier Jourdan, who is professor at the University of Clermont, Auvergne in France, and shareholder of the UNESCO Chair in Global Health and Education. And he will talk about lifelong learning for health, breaking down silos, and talk about the UNESCO Yeonsu Declaration for Learning Cities and the new enactment guide based on that. So, Didier, the floor is yours.
Thank you very much, Rolf, and good morning to all of you, or good evening for the colleagues in the other side of the planet. Yes, I'm going to talk about the Yeonsu Declaration and the key issue of what we call lifelong learning for health, which is one of the key topic of our intersectoral work. 3 ideas to be shared with you. The first one, I'm going to be very brief because my good friend Rolf already gave a kind of introduction to my talk. The second one is to put the spotlights on the local level and especially the city level, and then to try to share with you some of the ideas we gathered from the experience of the more than 300 learning cities of UNESCO. As Rolf said, the population is not the problem in the field of health. It's more part of the solution. But of course, everybody knows that to move forward in terms of health for all, we need to build capacities. And building capacity goes through the development of the competencies and the knowledge of the population. And it's not only, few experts, few leaders, few policymakers. This is all the population, and this is also all over the life cycle. Very often we are focused on the young generation, the children, the adolescent, the young people when we talk about learning for health. But in fact, this is something that is one of the main characteristics of human being. We are learning from the beginning of our life to the end of our life. And Yeonsu going to talk about healthy aging in a few minutes, and it's probably going to put the emphasis on health literacy at old age. So clearly, when we talk about the future of public health, how could we push forward, the dynamic that would lead to health for all? We really need to have in mind that the development of the capacity of the population is critical. And to do that, of course, we need to break down silos. Where? How? Of course, at national level, the mission of the governments and the agencies is to create the conditions for real, effective intersectoral action. But the key level is probably the local level. Why? Because we have fantastic entities, institutions, people who are able to contribute to learning for health. Of course, this is the formal education setting, the schools, the higher education, but it's also the non-formal setting. And this is why Catherine, in a few minutes, is going to talk about the way in which we could harness the power of the non-formal education settings, what we also call popular education, to build the capacities of the population in the field of health. And this is the after-school program, the cultural system, also the healthcare system. We need to put the emphasis on the educational role of every healthcare professional, not only in the hospitals, but also the primary care system, the home health and care, because this is where we reach most of the vulnerable people of the population, elderly people, but also people with chronic condition and handicap. This is also the sports club, the faith communities. All of them are, I would say the galaxy of the non-formal education settings, and they are a key asset for public health. But of course, to build intersectoral work, to break down the silos, we need to speak the language of the people with whom we want to work. And the final, lever for change, this is the informal learning, families, peers, friends, social medias, and you all know that, for example, WhatsApp had a key role in the field of a sexuality and relationship education, for example, during the COVID-19. And that's also true at the other end, I would say, of the life, where the social networks play a key role in information sharing. So what's important is to speak the language of the other people. And to do that, we need to have in mind that the focus for the people from the health sector and from the social sector, from the educational sector, is not the same. And that's why we always need to try to think through the point of view of the other people. And probably what we learn that is the most important from our experience with the more than 300 cities of the global network of learning cities is that for people to be involved in this process of lifelong learning, of course, we need to talk about the health literacy, the capacity for people to take care of themselves and their family. But we also need to open up to something bigger, which is citizenship, because, you know, for an association working at a local level, what is absolutely major? This is the vision. This is where people want the young generation or the old generation to go to. And this is citizenship. And clearly, yes, to speak to the people, we need to have, I would say, a larger perspective. And of course, for us, this perspective, this is the Sustainable Development Goals, because things are linked. So lifelong learning for health is a key asset for intersectoral work and to break down silos at the condition that we put health in a broader perspective, meaning as a part of citizenship, and in our field, citizenship for health. This is the need for people to, have the knowledge, the skills, the capacities necessary for actively participating in decisions about health as citizens. What I just said is the background of an important declaration, the Yeonsu Declaration for Learning Cities. And 3 years ago, after a conference in Yeonsu, that's why the name is the Yeonsu Declaration, there were a work that led to more than 300 cities, and then all the executive power in these cities to declare that they really want to move forward in terms of lifelong learning for health and put, the emphasis on the development of policies and also the way in which it's possible to put these policies in practices. Now, having this framework, what could we do? I would say concretely on the operational level. Of course, as always, it's always complicated. Everybody's super busy. How could we create intersectoral work with people that are 100 under pressure from their side? And this is probably the key dimension of the work of the UNESCO Institute for Lifelong Learning and the UNESCO chair. The idea is not to implement a new approach of lifelong learning, but it's more to try to translate in every local context a dynamic that put together all the key actors of health, education, and social dynamics around a common project that is absolutely key for every policymaker at the local level. Have a look, we don't talk about implementing the declaration. We are talking about enacting, because enacting means that every process, of course, have to be translated at the local level. What is the only important slide of my talk? This is this one. What is the approach? The approach is, first of all, to realize that a lot of key actors at a local level also contribute to lifelong learning for health. Think of the boxing club in one of the cities with whom we are working. The educators, even if they are talking about box, of course, they are interested in contributing to health education to young people. And that's the case for all the sports clubs, for many associations. But of course, to move forward, we need to share that, to align it in a policy and to improve it, of course, because there's gaps. Valuing, sharing, aligning, improving is one of the ways how we could breaking down silos. And then how could we put together all that things around a unique flag? Again, it is by talking about the health learning pathway. Learning pathways now are really important at local levels because, you know, education is based on the contribution of many key actors at the local level. And having one of the dimension of these learning pathways focused on health is probably something that's going to help in many, many cities to break the silos and build the capacity of the people all over the life, from the perinatal period to old age, by taking together all the dynamics, the families, the formal education settings, the workplace, the healthcare services, all the community services, associations, and sports clubs in a policy. But what's important is that this policy is mostly based on what is already done, and it has to be recognized and enriched. Then this is the idea, and the work done by the UNESCO Institute for Lifelong Learning is to try to put together all these initiatives. We are talking about knowledge production and transfer ecosystem. It means having the people, the practitioners, the policymakers, the academics together. But of course, nothing's possible without the people. Nothing about the people without the people. That's why participation is the key issue when you want to promote lifelong learning for health and to break down silos. Thank you very much. Over to you, Hof.